A very warm welcome to all of you. My name is Tanu Girotra and I'm from OneStage. I'll be moderating today's webinar on equitable and sustainable early childhood development, and I'm delighted to welcome you all to this important discussion. Before we begin, let me briefly introduce OneStage. We are a non-profit organization committed to advancing inclusive and sustainable development across healthcare, education, climate action, and livelihoods. Through collaborative partnerships and community centered approaches, we strive to create lasting social impact. And as part of this commitment, OneStage is implementing the PRARAMBH initiative under Early Childhood Development Program in Odisha, with support from the Department of Women and Child Development and the Leer Foundation to strengthen early childhood development through community engagement and parental participation. So today's webinar is one such initiative, bringing together experts to discuss the critical importance of early childhood development and explore ways to strengthen outcomes for younger children. Now we are privileged to have our three distinguished speakers with us today, Dr. Anubha Rajesh, Dr. Charu Chugh, and Mr. Shashank Khare. They bring a wealth of knowledge and experience, and we look forward to hearing their valuable insights. So before we begin, I would like to request all the participants to kindly post your questions in the chat box throughout the webinar, and we have a dedicated question and answer segment at the end, during which we will address as many questions as the time permits. So, with that, let us begin today's session. And it gives me a great pleasure to introduce our first speaker, Dr. Anubha Rajesh. Dr. Anubha is an independent consultant specializing in early childhood development with extensive experience in research, program evaluation, and policy. She has made significant contributions to advancing early childhood development, particularly for children for vulnerable communities, including children with disabilities and those affected by conflict. Earlier, she served as a chair professor at the Center for Early Child Development and Research at Jamia Millia Islamia, where she led several research and evaluation initiatives. Dr. Rajesh has also represented her work at national and international forums and has authored numerous publications in the field of early childhood development. Now, we're delighted to have her with us today. Over to you, Dr. Rajesh.
Good morning, everybody. Thank you, Charu. Thank you, Tanu, so much. First of all, I would like to congratulate OneStage for committing themselves to such an important area, early childhood development, and it's a topic of topical interest. Recently, the NEP has been talking about the foundations, and foundations need to be strong. With this, I would like to begin my presentation, and let's start by sharing the presentation. Please let me know if you could see it. Is it visible? I hope it's visible.
Yet,
yes.
Not yet, ma'am. It's not visible. Now it's visible.
Great. Thank you so much. So the topic of interest for today, investing in the early years, we want to start by it because we want to lay the foundations for a prosperous tomorrow. The quote is very well said and has been talked about in the nurturing care framework. If we change the beginning of the story, that's the child's start of the life, conception, we can change the whole story. And it is significant. It is evidence-based. So when we talk about early childhood development, what is the period that we are looking at? We start from conception, which is the entire pregnancy period. Then we have the child in infancy, toddlerhood, and typically the child does spend this time at the home front, surrounded by the primary caretakers, caregivers, which would be the family, the mother, the father, the siblings, grandparents, uncle and aunts. Then the transit is from the home to the preschool years. For a larger population, Anganwadis, but then there are private preschools also. And this is almost in the bracket of 3 to 6 years. And the child then transits to the early grades. And this is the period of 6 to 8. When we talk of this entire continuum, why are we talking about all these stages? Because we want to ensure that the child transitions seamlessly from one stage of life to the next stage when the child is first exposed to an Anganwadi, the outer world, and gradually to an even larger world, which is the primary school. Uh, Diving deep now into the topic of early childhood development, I thought it would be very important to talk about that why we need to invest in the early years. There are several perspectives that have talked about and provided evidence that yes, early childhood development needs the right kind of investments. And if we invest appropriately and at time, then definitely we'll be seeing a productive population at the later end. And I like to start with the perspective of the rights. The rights perspective talks about that every child has the right to survive, develop, learn, and be protected from the harm. The children, whether they are from the disadvantaged group, whether they are from the marginalized group, whether they are children with disability, it could be either gender, it could be either ethnic groups, it could be any location. They all deserve an equal start, which will promote equity and help us reduce the disparities, which is one of the big forte for the National Education Policy 2020. Having said that, we've had certain forums that are talking about that how we need to be committed to give the ensure the rights of the child. So we have the Convention on Rights of the Child that lays out the several rights of the children. We have the Sustainable Development Goals, which talk about quality education and various other phases that again contribute to help children reach their developmental potential. At the national level, we have the recent National Education Policy. Under the ICDS, now we have Mission Saksham Anganwadi, Poshan 2.0, and the Poshan Abhiyan, Health Mission, and Mission Vatsalya that ensure an integrated and a comprehensive approach. And uh, I feel very proud to talk about that when India had envisaged the ICDS framework. I think so. We were one of the first countries that had thought about the life cycle approach. And way back in 75, we started from the period of adolescence, not even pregnancy, to ensure that the women get the best of health before they are capable. They start having children. The development perspective is again one of the important ones, which talks about that all the different domains that a child is developing in simultaneously, whether it's the physical, cognitive, language communication, social emotional, the executive functioning, and the self-regulation, all are developing at a very rapid pace. And we need to make sure that they get the right kind of stimulation and the right kind of environment to help them grow in all these different domains. And they all are dependent on each other. So it's important that we are careful that all the domains are looked into. What are the benefits if we kind of look into it? If the child will succeed in school, they will be able to complete more of years of education. There'll be less dropout. The health will be better. When they become higher individuals, adults, they'll have higher incomes and they'll contribute positively to the society. The neuroscience perspective, which has been now almost a decade, more than a decade, we've been talking about, it's a unique window of opportunity. We all know that as the child is developing, there are 1 million new neural connections that are forming every second. And this is affected by the nurturing care framework, which you can see in this diagram, which talks about the child having a good health, adequate nutrition, responsive caregiving, safety and security, and opportunities for early learning. And it's very important to keep in mind that when we are talking about this nurturing care framework, we ensure that our children are away from negative experiences because they can hinder the development of the brain. And if we give them the positive environment, then definitely they will get the opportunities where the million connections, the neurons will start forming the synapses and they will proliferate and the child will develop in the brain. So when we talk about building the child's brain, 80% of the child's brain is formed by the age of 3, by the age of 6, 90%. Every meal that the child takes, about 75% of that meal, if it's nutritious, will help building the brain. And just 15 minutes of play, engagement by the caregivers with the child can spark thousands of brain connections. Finally, the fourth perspective is the economic perspective, which our Professor James Hickman, he was an economist, he is an economist, has talked about. And through a longitudinal study he has done, he has talked about that if we invest in the right time, at the right time, we'll be able to save at least 7 to 10% of annual returns from the high quality early childhood programs. The big important part is high quality. That is something we need to keep in mind. If we are not giving quality, we are not achieving those investments that we are talking about. Hickman talks about that we need to concentrate, the attention needs to be given to the children who are from the disadvantaged background. And kudos to all the NGOs and organizations who are reaching out to the unreached, supporting early education at the field level, at the last mile also. So the skills that have developed during the early period in the ECC phase, that will help the later learning. If we give this preventions, we will have less costs for the remediation and we will have healthy, educated individuals. If we talk about the benefits, we have already talked about how the educational attainment will be higher. The labor productivity rates will be greater. The costs on health, if we take proper nutrition, have the health system, ensure we have educated population, there'll be reduced healthcare cost. The spending on remedial education is very less. And the best part is that the cost for social protection and social justice are also reduced because we have a positive, productive population. Moving forward, so what needs to be done? We know that these arguments are talking, whether it's the rights perspective, whether it's a developmental perspective, economic perspective, or the neurosciences. They all talk we need to invest in early childhood. But yes, what should be the steps to ensure that we can give quality education to our children? Well, the first is ensuring these quality services for early childhood development, giving it a comprehensive approach. If we are lacking in nutrition, obviously development gets affected. If a child is not feeling well, if the child is sick, the child is not able to attend the programs that are there for the children, the child stays at home because he's unwell to move out. So health also is a very important part. Developing early learning opportunities in all the domains, they interact and affect each other. It's important. Having a safe environment, because child is an active agent. The child wants to learn the moment the child comes into this world. And if we provide a safe and a secure environment, the curiosity of the child is sparked. The child is not hesitant to move out. The positive environment will give all the opportunities to learn and imbibe more. Providing early learning environments is crucial. Quality learning materials and the curriculum that should be developmentally appropriate is so important. So, wow, how we can reach it? By the professional development, capacity building of the Anganwadi workers and other people who are working with young children. We ensure a play based pedagogy that allows a child to stay active, to participate, and learn in a friendly, child friendly environment. We need to empower the parents, families, and communities. And over and above, we need to have the strong monitoring and coaching systems to help this system grow, progress, and sustain. Somewhere my, yeah. So, while I'm not diving deeper into the area of nutrition or health, I would talk a little bit about responsive caregiving, which is very important for our children. What do we mean? What do we want to say when we talk about responsive caregiving and a positive environment? Well, these are those consistent, warm, and timely interactions between the caregivers and the young children, which will help children to feel secure, learn actively, engage actively with different materials in the environment, and develop optimally. What could be the different things that one could do while providing responsive caregiving? Eye to eye contact with the child is very important. Smile during feeding, talking, engaging is so very important for the child. The child feels comforted, the child feels confident. Responding promptly when the child is crying, there is discomfort, or the child may be tired, or there could be any other thing which is creating something negative for the child. We need to respond and see why the child is not feeling comfortable, and how and what we can do to ensure that the child feels comfortable. Talking and singing to the child when holding him, massaging, feeding the child. And I'm saying him, I'm sorry about it. I need to say her also, both boys and girls. Observe the children's cues and interests. You need to be sensitive to the child's cue. The child could be crying for various reasons. The child could be curious about various things. If the child is still an infant and is not able to talk, many times the cry itself, is able to inform that why the child is not feeling comfortable. Is the child hungry? Is the child in pain? Or is the child wanting to sleep? Or is the child wanting you to talk to the child? So, there would be different cues the child will be giving, but you need to be observant and sensitive that what the child wants and I provide. Encourage exploration in a safe environment, which is again very important, as spoken before also. Praising and encouraging the efforts of the child and not only the success. Please remember that we need to praise each and every effort the child is putting in. Avoid any harsh punishments or humiliations. We do not want the child to have a low self esteem. We want our children to be confident and have a good self esteem to grow, progress further. Create predictable routines. That is very important. The child should be anticipating next. This, I've had my breakfast. Now it's my time to play. When I get up, it's my time to brush. So those predictable routines help the child to set up the whole day routine. Spending quality one time with the child and avoiding mobiles. Please, that's very important. When we talk about spending quality one-on-one time, the important fact that we need to keep in mind is that it doesn't need to be the 24 hours. It doesn't need to be long hours. Even 15 minutes, as I spoke earlier, can spark the interest in the child. So from 15 to half an hour to 1 hour, how much time a father gets, how much time a mother gets, a grandparent gets, please spend that time with the children. Finally, we talk about the early learning opportunities. And when I spoke about it, I was talking about, that it has to be developmentally appropriate. Children, when they are infants, they are growing very rapidly. And many times by each month, also the activities will differentiate. So we will see that a child in the age of 0 to 3 months, there are different activities. By 3 to 6 months, there are various activities. The child, when the child is in the age of 6 to 12 months, there are different activities. I'm not going through these activities, but yes, talking to the child, narrating stories, singing rhymes, spending quality time, involving the children in simple household tasks so that they start getting responsible, they start understanding that these are some things that we need to contribute to, helping them to solve problems. Don't just go ahead and give them the answers. Let them learn. They want to learn by trial and error. They understand what is cause and effect. And most important, help them to make decisions. Let them do it. They will become confident and they'll learn. So I think so. I said many things in this small, brief period, but I kind of wanted to uh, just share the platform with you that there are numerous ways in which we can reach out to the children, help them to develop optimally. And I think so I should pause at it and take the rest in the questions. Thank you so much.
So thank you so much, Dr. Rajesh, for that insightful presentation and for sharing your valuable perspectives. Now, we will take questions after all the presentations so that we can have a consolidated discussion. Now, it is my privilege to invite Dr. Charu Chugh, our second speaker for today's session. Dr. Charu is an associate professor at IILM University, Greater Noida. She's an academician, researcher, and mental health professional with over a decade of experience in child welfare, mental health, gender studies, and community development. Her research and publications continue to contribute significantly to the fields of child development and mental health. Now, the floor is yours, Dr. Charu. Yes, you
Am I
are.
audible? Uh, Okay.
Yes, you are. You are audible.
Thank you, Tanu. I'll thank the organizers for initiating such a wonderful webinar and giving me an opportunity to be the part of it.
Dr. Charu?
Then health, nutrition, and finance, who is too often left out of the ECD conversations. Now,
You're not audible, Dr. Charu. Dr. Charu, you're not audible. You're not audible, Dr.
before
Charu. I
the
think there's a
age of
technical.
5.
I think there's a technical glitch, I suppose.
So, science tells us that learning begins before the birth. Nearly 90% of brain development occurs before the age of 5. Every interaction, every smile, every conversation, every nutritious meal, and every safe environment contributes to shaping the child's future. ECD, early childhood development, spans conception to 8 years. The first 1,000 days, that is from pregnancy to age 2 years, are particularly critical, right? So let's move to nurturing care framework. In the nurturing care framework is to stable environment created by parents, families, communities that promotes child health, nutrition, security, safety, responsive caregiving, and opportunities for early learning. As Dr. Anubha ma'am has already gone through this, it's good health, adequate nutrition, safety and security, responsive caregiving. That is our today's focus, and the opportunities for early living. These five are not just the checklist; they are interrelated. A child can be fed, safe, and healthy, and still be developmentally underserved if caregiving is not responsive. Tanu, I hope I am audible to everyone and the PPT is
Yes, you
visible.
are. Yes, you are audible. We can see
Thank you.
the PPT as well. Yeah, thank you.
Yes. Yeah. Now I'll run through all these. See, good health comprises of antenatal care, safe deliveries, immunization, regular health checkups. Then comes nutrition. Nutrition is all about breastfeeding, complementary feeding, micronutrients, balanced diet. Responsive caregiving is talking to babies, playing with them, keeping eye contact, emotional warmth. Safety and security, actually child needs protection from violence, neglect, abuse and toxic stress. Early learning says here learning begins from birth. Example, learning could be in a form of singing, storytelling, naming objects, household conversations, right? Now I'll move to, yeah, an example. See, a baby cries. Responsive caregiver says, a caregiver responds promptly, comforts the baby, identifies the needs. But the non responsive caregiver would ignore or scold the child. Responsive care builds trust, इमोशनल रेगुलेशन एंड सिक्योर अटैचमेंट. देखिए, छोटा बच्चा बोल नहीं सकता, लेकिन उसका रोना एक मैसेज होता है. रिस्पॉन्सिव केयर गिविंग का मतलब है उस संदेश, उस मैसेज को समझना और प्यार से जवाब देना. राइट? Yes. Now, I'll just take 2 minutes for the responsive care. Specifically, it refers to caregivers' capacity to notice, understand, and respond appropriately to child's cues and needs. This could be a bi-directional, relational processes rather than one directional act of providing for the child. Right? But there is, but here is actually the question that framework alone doesn't answer. What makes a caregiver able to be responsive is the first place. Now I'll incorporate Bronfenbrenner's ecological system theory in this. See, Yuri Bronfenbrenner says child development happens within the multiple interconnected environments. The first is the microsystem. This is the immediate environment of the child, which comprises family, caregivers, school, peers. This is where the responsive caregiving directly happens. Second level, second layer, second circle is mesosystem. This is the connection between the microsystem. Example, how well home life and school or Anganwadi life reinforce each other. Exosystem are the settings that child doesn't directly participate, but that affect the child anyway. Like as parents' workplace leave policy, caregivers access to healthcare, right? The next concentric circle is microsystem. These are the cultural attitudes, ideology, national policy, like how society views disability, gender norms, around who provides care. ECD policy itself comes under the macro system. Lastly, there is a chrono system. These are the time dimension. How these systems shift across the child's life and across the historical moments like policy change, migration, crisis like we all have observed pandemic, COVID-19, COVID-20. Yeah. So, responsive caregiving happens at the micro level, but it is enabled or constrained by everything outside. That is exosystem, macrosystem, and chronosystems. As stressed earlier, the unsupported caregiver is a system with no parental leave, no healthcare access, no community support, is simply choosing to be less responsive. The system is shaping what is possible. So, the key message here lies that Bronfenbrenner's remind us that nurturing care is not only the responsibility of parents, but also of school, communities, healthcare systems, workplaces, and the government. Now I'll move to the continuum of care. In the responsive caregiving is the relational core of nurturing care. Then health, nutrition, and protection are its core foundation.
We can't hear you, Dr. Charu.
Depends on the health and well-being before the child is actually born. The WHO Nurturing Care Framework identifies good health as one of the 5 essential components of early childhood development. Health is not simply the absence of illness, it means ensuring mothers are healthy during pregnancies, babies are born safe, children receive preventive health care, and illness are identified and treated at early stage. We all know healthy mothers lead to healthy babies. The first 1000 days, that is from conception to 2 years of age, represents the most crucial period of brain development. During this time, everything that affects the mother affects the development of the child. That is why quality of antenatal care is so important. Folic acid supplementation, which prevents anemia in mother, supports the healthy brain and neural development in the baby. Healthy pregnancy should be allowed by the skilled birth and attendants and institutional delivery, ensuring safe childbirth, immediate newborn care, and early initiation of breastfeeding. This is actually the continuum of care from survival to thriving. This continuum includes all the antenatal care during the pregnancy, skilled birth attendance at delivery, routine immunization, growth in the monitoring, early identification. Together, these interventions help child to move from survival to thriving, right? Now, the maternal well-being and nutrition. See, one aspect is often overlooked is maternal mental health. Conditions such as postpartum depression, anxiety, chronic stress reduces caregivers' ability to respond warmly and consistently to the child. Notice how this connects directly to the previous discussion we had on responsive caregiving. Caregivers' own physical and mental well-being is preconditioned for responsive interaction. When mothers are emotionally supported, they are better able to nurture, communicate, and bond with their children, promoting secure attachment, language development, and emotional regulation. If I simply put all this, caring for mother is also caring for children. As we all know, prevention is better than cure. So, routine immunization protects the child against life threatening diseases, while growth monitoring helps detect undernutrition or poor growth at early stage. The health nutrition go hand in hand. Good maternal nutrition during pregnancy supports the fetal growth, while exclusive breastfeeding for first 6 months, followed by nutritious complementary feeding alongside continued the breastfeeding up to 2 years, provides the best foundation for immunity, brain development, and healthy growth. Now we move to protection creates safe environment. Children also require protection from violence, neglect, abuse, and toxic stress. Repeated exposure to fear, violence, neglect without supportive caregiver can disrupt brain architecture and negatively affect lifelong learning and emotional health. In contrast, safe, nurturing, and relationships buffer stress and promote resilience. Now we see India's community-based response. In India, the services are delivered largely through ICDS, that is Integrated Child Development Services, using Anganwadi centers, which provide health services, supplementary nutrition, growth monitoring, and poor school education with caregiving counseling. Complementing to this, Poshan Abhiyan, India's national nutrition mission, aims to reduce stunting, wasting, and anemia, which improve maternal and child nutrition through community participation and behavior change. C. Healthy mothers lead to healthy babies, and healthy babies become healthy adults. When we ensure good maternal health, proper nutrition, timely health care, protection from adversity, care of well-being, care and well-being, we are not merely helping the child to survive. We are enabling the child to learn, develop, and achieve its full potential. Thus, in true essence, nurturing care framework are the foundation for building healthier families and strong communities. Now we come to well-being of caregivers. Healthy caregivers raise healthy children, we all know. So far, we have already discussed responsive caregiving, importance of health, nutrition, protection. However, none of these can be sustained unless caregivers themselves are healthy physically, mentally, and socially. Caregivers' well-being is not only important for parent but is fundamental to child's healthy growth and development. Well-being during the pregnancy. Caregiver well-being, mother's well-being during the pregnancy. A healthy pregnancy creates best possible start for the child. What can be it is included regular, we have already discussed regular antenatal checkups, adequate nutrition, adequate sleep and rest, stress reduction, mental health screening, and most importantly, family support. When partners and family members share responsibility and provide emotional reassurance, mothers experience less stress and healthier pregnancies. Well being during the lactation. See, after the childbirth, health remains equally important. During the lactation, caregiver needs there should be a healthy, balanced diet and adequate hydration, right? Then emotional support from family members, healthcare providers to reduce the feeling of isolation, exhaustion. Many mothers experience maternal depression, anxiety, postpartum depression. As we discussed earlier, responsive caregiving depends on the caregiver's own well-being. Poor mental health weaken responsiveness to child's needs, secure attachment, and opportunities to play, communication, and early simulation. Ultimately, this will affect child's emotional, cognitive, and social development. Now, a very important aspect is shared responsibilities. Father's involvement. देखिए, caregiving is not only the mother's responsibility. Researchers have consistently shown that children benefit greatly when fathers are actively involved. जब पिता बच्चे के साथ खेलते हैं, बात करते हैं और कहानियां सुनाते हैं, तब सिर्फ बच्चा ही नहीं पूरा परिवार मजबूत होता है. Simply in everyday interactions such as playing, reading stories, talking, comforting, and participating in daily caregiving strengthen the parent child relationship and promote language, emotional security, and cognitive development. We should therefore encourage share parenting, where both parents are actively contributing to nurturing the child development. Then we come to the role of support systems. Family cannot do this alone. Strong support system makes caregiving more effective. This includes extended family members, community support, ASHA workers or Anganwadi workers, NGOs, mental health professionals, peer support groups, government programs, etc. Together, these networks help caregivers feel supported and better equipped to care for their children. Now, these are some practical recommendations which I have, created for parents. Talk to child every day, read stories, respond sensitively to crying, ensuring timely vaccination, reduce time screening, and spend quality times. For NGOs, organizing parental workshops, home visit, nutrition education, maternal mental health screening, and early simulation programs. At university levels, I'll also say strengthening community outreach, providing student internship, promoting parenting education, undertake research that informs evidence-based policies and practices. Lastly, I'm sorry. Yeah. Lastly, I would conclude that the well being of caregivers is the well being of the children. When caregivers are physically healthy, emotionally supported, and socially connected, they are better able to support and provide, they are better able to support it and provide the love, security, and responsive care that every child need to survive, thrive, and achieve their full developmental potential. It takes more than a parent to raise a child. It takes families, communities, systems, and society that creates. When we invest in caregivers, we invest in every child's future. Thank you so much.
Thank you so much, Dr. Charu, for the wonderful presentation. Now it is my pleasure to introduce our third speaker for today, Mr. Shashank Khare. Mr. Khare is a developmental professional with over 14 years of experience in education and early childhood development at HCL Foundation, where he leads initiatives focused on strengthening public systems, promoting community engagement, and advancing gender equitable caregiving practices. We look forward to hearing his perspectives from the CSR and implementation ecosystems. Over to you, Mr. Khare.
Yeah. Uh, hi. Good morning, everyone. First of all, thank you to OneStage for giving this platform where we can share the work that we are doing in SL Foundation. At the same time, I can bring the CSR perspective, the kind of work that we are doing with in the early childhood care and development space. So I'll be sharing my screen. I have prepared some slides here. I hope my screen is visible.
Yes, it is.
Yeah, sure. So first of all, a brief introduction about me. I am Shashank, and I come from a technology background. I I'm a software engineer basically. Then I shifted to the development sector after working for 2 years in this technology sector. I did my post graduation, and from last 15 years, I'm working in this development sector only. Currently, I'm working with Excel Foundation. I'm leading their early childhood care and development and education vertical in their urban CSR program, that is Uday. So I'll move to the next slide. First of all, we need to understand why CSRs should invest and should work in the area of early childhood care and development. So ECCD is built on the conviction that the quality of care that child receives before the age of 6 determines the trajectory of everything that follows, whether it's school readiness or emotional well-being or cognitive development, language development, social development of a child, and ultimately the place of child in the world. So our interventions are built upon these four factors which I have mentioned in the slide. At 90% of the brain development take place before the age of 6. And according to a Nobel laureate James Hickman, he's according to his research, 1 rupee invested in child's development give you the return of 12 rupees in person's lifetime. And one of the one of the alarming factors that for more than 47% of children below the age of 5, they are under stunted condition. And below in the 0 to 8 is the crucial period. Whatever a child learns will support his lifelong journey. So our ECCD intervention are built upon these factors and inspired from these factors, and we are just taking the work comprehensively to all the locations where we are investing in. So what is the role of CSR, how they can contribute and be the anchor of change? First of all, there is a need to understand that CSR can never replace government. They can only fill the gap. They can present some best practices, pilot models which can be replicated across. And first of all, I think corporates, especially CSR, they can showcase a convergence model, how different organizations, government department, NGO, civil societies, and corporates can come together and create a model that can be replicated across. At the same time, in SL Foundation, we have a convergence model where we work. For example, if you're working in the early childhood care and development space, we will have a convergence of different thematics. Because if you talk about integrated child development scheme, the services itself is very comprehensive. It does not only talk about the child readiness, it's talk about the child readiness, school readiness programs, talks about the health, nutrition, immunization, maternal and child health, and referrals for identification of early disabilities. So there are a lot of things, and ICDS itself is very comprehensive scheme. So yeah, I'll now give you the overview of SL Foundation's work in the ECCD space. So under SL Foundation, we are working in the length and breadth of the country, and our flagship programs are divided across different flagship. So we can work in different geographies. We have a rural program, we have urban program, then we have a program in which we are providing a grant to thematics like education, health, environment, and we have a sports program. And I am a part of urban CSR, that is the Uday program under SL Foundation. So in Uday program, we are working across 6 geographies where we have the presence of SL Tech. So Lucknow, Noida, Bangalore, Chennai, Madurai, Vijayawada are the few locations in which we are intervening. So earlier we have taken a lot of Anganwadis in our work. More than 300 plus Anganwadis was part of the system, but we later, of year on year, we have understood that we have to work very comprehensively. Maybe the cohort of Anganwadis in which we are working should be less, but the work should be very comprehensive. And drawing upon that, then we have reduced the number of Anganwadis and we have a more comprehensive work. And the NGOs which are working, they are the subject matter expert who have collaborated with us and working in these geographies, and they have showing a very collaborative work and very comprehensive work. So in the next slide, I will also talk about the 4 pillars of early childhood care and development model that we have in SL Foundation. So in our ECCD, basically in SL Foundation is divided across 4 sub-thematic pillars. First is system strengthening, where we are working in government Anganwadis and we are providing a safe learning environment for the children to learn and explore. Then we are providing extensive training programs for the Anganwadis in collaboration with ICDS department, so that we can improve their pedagogies. We can help them understand the various trackers that government is introducing on monitoring mechanism, development milestone, and how the parents can be involved from the very beginning, and they can also track the development milestone of their children and they can do the growth monitoring at home. Then uh, we are having a very unique model, that is a community crash model, that here we are working in those communities where we don't have a sufficient Anganwadis or government Anganwadis in the setup. So it is beneficial especially for those parents where both the parents are involved in the economic activities. And these community crash centers, they operate from morning till evening, and these are very much aligned with the ICDS services. And these crash, first of all, I would like to clarify that these are not the parallel system. These all crash models are in alignment with the ICDS department. So there are many crash in which ICDS department has provided their human resources as well. They are also providing the nutrition support in 5 of our centers in Chennai. Similarly, we have different geographies, different kind of supports are extended by the ICDS department. Then, as also mentioned by Dr. Anubha and Dr. Charu, that gender equitable parenting is also important. So how we are engaging parents? So we have a very unique intervention that is called a Daddy Cool initiative, where we are working in the slum communities, and currently we are working with a cohort of over 500 fathers. So we are encouraging them toward the positive parenting. And when we have done the impact assessment last year, we found very uh, encouraging findings. We had like 95% of the children, they perform better in their academics when their fathers are involved. When fathers are involved in the household chores, mothers are also getting the time to contribute in the economic activities. Children, they feel more confident, and these fathers are becoming a role model for other fathers in the community. And now we have a fourth model in which SL Foundation is working, is the caregiver capacity building, that is toward the responsive caregiving. As we know, there is a shortage of caregivers in the community itself. So in the community, we are identifying the women or whoever is like interested in becoming a primary caregiver, who wants to play the role of a caregiver. So we are providing them the extensive training. And so they can and the purpose of these training programs is also to make our community care center more sustainable. So the community members who are getting trained, they can also run the similar community crash model in their community, and they can charge some nominal fee from the parents who wants to leave their children in these centers. So currently, out of these 18 centers in which we are working, one of the community care centers is going to be operated by the community. So this is how we are trying to build community partnership in our model. And we have done the training of 21 community caregivers, and out of these 21, 8 they have got the job in the pre-primary schools. So they are also getting, job opportunities in the care economy. So as I've already mentioned that SL Foundation does not operate in silos. We have a very strong convergence model where we have subject matter expert NGOs who are demonstrating the best practices which can be replicated by other CSRs, NGOs or government. Then we have a very strong collaboration wherever we work. We have a very strong collaboration with government department through MOUs, through formal collaborations, and we are working together. So we should contribute or complement the work that government is doing. So again, health department plays a very important role here. We, in order to make sure that each and every child is immunized and they they should not fall under the category of malnourishment, or even if they are, what are the measures the parents and caregivers can take to help them move from like red category to green, and green to the red to yellow, and yellow to normal category. And then family and care community participation is also one of the sits at the intersection of our work, because as also mentioned by Dr. Charu that to raise a child, it is not just the responsibility of mere parents. It in fact it's the responsibility of the entire community to create a safe environment for the child to learn and explore. So these days we have seen not many CSRs are working in the area of early childhood care and development. For them, still education, health, skill development, these are the major areas and thematic areas in which they want to intervene, because give they achieve the short-term results. But if you are intervening in early childhood care and development, you have to be very patient. You have to work for at least 3 to 5 years. Then only you will get the desired outcome. And at the same time, everything that you invest or everything that you put in early childhood care and development, they are all inputs. Child is the only outcome that we have. And a child who is like performing better or have a better development milestone or age appropriate development milestone is the only outcome that we get from our early childhood care and development. So we are not running for the numbers. We are not showing how many numbers of Anganwadis or children are impacted under our program. Our primary objective is to make sure that whatever intervention we are doing, it should be holistic in nature. It should have the involvement of each and every person involved, stakeholders. We should have a strong monitoring and evaluation mechanism in place. So whenever we want to pitch something to government, if we want them to replicate the model that we are running, so we will have a evidence-based impact that government can replicate. And again, we always make sure that we have a proper need assessment and exit strategy for a program that we are doing. So in when we are exiting, we will make sure that the impact that we have created in on ground, they should not go waste once we exit. And the community should be there, some active members should be there to lead the show on our behalf when we exit. So, from CSR perspective, as I've already mentioned, there are not many CSRs who are working in the field of early childhood care and development. So there are limited, there are handful of CSR, but what they expect the NGOs when they invite proposal for early childhood care and development. So we keep on receiving a lot of proposals which are which lack vision, which may not be very, which are not multi-directional. They cover only, for example, school readiness. Some covers only nutrition part. Some covers only uh, uh, maternal and child health. But when we work into a Anganwadi centers, we want the program should be comprehensive in nature. It should promote inclusiveness. It should have a sustainability. It should have a strong monitoring and evaluation mechanism. It should have a good financial models. and it should be holistic in nature that covers each and every services of ICDS scheme. So I think this session has been joined by the subject matter expert or the leaders of NGOs. So I don't think I need to talk how the proposals are made. But of course, when we are working, what we are expecting from the NGOs and implementation agency, that I can definitely share. Like, we always want the convergence strategy should be there, as we are not working in silos, we are not running any parallel system. So there should be a strong convergence with government organization. We should have a clear cut theory of change, like uh, what are the inputs we are going to have in the program, activity output, outcome and impact level indicator should be clearly mentioned. It should have a 3-year plan, like how the program will graduate from the first year to second year to third year, and should be dynamic in nature, that it should adopt to the changes that it might require from the field level experience. Then we have often seen that NGOs, they give the administrative charges of more than 10%. So now these days, also it's a mandatory from Ministry of Corporate Affairs that we have to limit the administrative and management charges to up to 10%. In fact, in SL Foundation, we are restricting it to 5. And each and every budget line item that we are defining under our proposal should be properly aligned. And fourth and important component is the sustainability plan. Again, that is something we always look up to, because we are working with the NGOs who are collaborated with us from last 10 years. But again, we keep on changing the kind of work that we are doing with us. There are many, as we have started with 250 Anganwadi centers, but currently we are working in only 160, because we have trained the Anganwadi workers in a way that they can lead it, they can take care of their Anganwadi centers. We are there to help them with the refresher training. In case any change in the pedagogy required, then we can organize training for the helpers, supervisors, Anganwadi workers, and can help them align. But they should be the change agent for the program. So generally, when we are working in early childhood care and development space, there are few challenges, especially when we are working in the community. So communities, especially the urban slum communities, they are not stable in nature. They often people, they are the migrants, they are coming from different places, from rural or small town in search of a better opportunities, or also with the aspiration to break the vicious circle of poverty. So they often keep on moving from one location to another, and if you don't have the cohort of stable program participants, it's always difficult to showcase the impact. Then in early childhood care and development, we should work with a vision of at least 3 to 5 years. 1 or 2 year of intervention is not going to bring any positive change. Then CSRs, we have seen many CSRs, they are running for the numbers, as we have already mentioned. uh, so for us especially, and for many CSRs I have seen, they look for the quality of work. So again, here the convergence practices can be the useful tool that can help you, bring quality in the intervention. And again, the monitoring and evaluation and theory of changes, these are the important factors that we should consider when we are working, when we are collaborating with the CSRs. And also inclusiveness, because if we see that early identification and early correction is the sixth service of ICDS scheme, but we often ignore that. We focus more on school readiness, nutrition, health, but this referral is a very important factor, and for which we have recently collaborated with National Institute of Public Cooperation and Child Development, that is NIPSIT, and they are supporting us with training of our Anganwadi workers, and so they can understand the process, how exactly they have to identify the children with development delays or any form of disabilities, which can be corrected in the very early phases. So I think this I've already covered, so I'll not go deep into this slide. So again, as I mentioned, when we are working in early childhood care and development space, we have to be very patient. And this first 8 years, we should not consider it as a program. This is the commitment that we need to have in order to align with the mission of Viksit Bharat 2024, 2047. And again, the convergence, when we are working in ECCD space, convergence is not a strategy. In fact, it is the only strategy that we need to adopt to create a deeper impact and long lasting impact. And again, child sits at the intersection. Child is the measure, everything else is the input. As we have already discussed, that we have to bring all the stakeholders together that can work together to help a child grow positively and optimally. Yeah. Yeah.
Yeah,
Thank
so thank you very much, Mr. Khare, for the wonderful presentation. Now we will move to our Q&A segment. We have already received a few questions from the participants through the chat. And still, I encourage everyone to continue posting their questions. And I'll begin with some of the participant questions now. Okay. So we have a question from Ms. Shweta. She's asking, how can ECD services become more inclusive for children with disabilities and developmental delays? What practical strategies, policies, and innovations can service providers, educators, families, policymakers adopt to overcome such overcome barriers such as accessibility, lack of trained staff, and attitudinal biases, ensure equitable, high quality support during the critical early years? Dr. Charu,
Uh,
would you like to address?
yeah, yeah, I would like to address this question as disability is, my area of concern. See, creating inclusive ECD services require more than just, admitting children with disabilities into the existing programs. It will require redesigning the system to meet their diverse needs. Through early identification, skilled professionals, accessible environments, family partnerships, inclusive education, assistive technologies, community engagements, ECD system can ensure that every child has an equal opportunity to reach their full potential. As already emphasized by Nurturing Care Framework, responsive caregiving, good health, nutrition, safety, security, opportunities for learning must be available to all children, including all those with disabilities and developmental delays. In also investing in inclusive ECD is both the matter of child's rights and one of the most effective strategies for improving the lifelong health, education, and social inclusion. That I could answer this.
Thank you so much, Dr. Charu, for this. Now we have another question from Shubhalina. She's asking, I would like to know, as per our work, we used to get children at the age mainly 6 to 9 years and have already missed the crucial period for their development. And mostly they are from leprosy background with malnutrition, illiteracy, broken family, begging, etc. In such situation, what should be out ideal interventions that can help us to support their cognitive, emotional, and overall development most effectively? I would like Dr. Anubha to please address this question, ma'am.
Thank you, Tanu, and thank you, Shubhalina, for such an important question. And I think so somewhere this is also related to an earlier question where they were talking about. There's just one more question. If a 6-year-old child has missed the important early childhood developmental experiences and is now struggling with social interaction and classroom engagement, what practical strategies can parents and teachers use together to help the child develop these skills? This was asked by Anukumari. So I think so somewhere both of these are very related. And evidence again has shown there's an interesting story of a adolescent called Jenny, and if you would kind of Google, you would get this in the net. The story talks about how this girl child was locked in a bathroom for years together, till about 10 to 12 years. She didn't know what is the world. That one bathroom was her place where she was not adequately fed, very poorly fed, and she did not get any exposure to communication, no language, no kind of stimulation. And when she was rescued and kind of admitted into a place where stimulation was provided, we did see some changes in her development, but they were very slow. So, having said this, if this window of opportunity of the early years is missed, it's not that it cannot, the child will not develop in the later years, but it will be very resource intensive. Lot of more time, lot of more committed and dedicated efforts will be required to help the child to develop. So when we were talking about the adverse experiences, and when we were talking about scenarios where children have to face harsh environments, whether it could be a humanitarian crisis or a crisis where the child has not been given any responsive caregiving, the child has not been given a secure environment, the child has not got love, the child has not learned to trust, the child's self-esteem is low, lot of efforts have to be first given to help the child to become socially, emotionally secure. Gradually, when the child does start, and I wouldn't be able to say that it could be 100% or so, but yes, there could be slight improvement, then the child also will start improving on the other domains, because we know that all the domains are dependent upon each other, but the social emotional domain is the most important one. The child has to feel safe, secure, and wanted to learn. And when that's established, language, cognition, physical motor, all those do come in with the right kind of appropriate inputs, but they have to be very intensive.
Thank you so much, ma'am. Now we have another question for you. It says,
Mhm.
how does gender bias influence a child's growth and the opportunities they get in early childhood development?
There were two questions again regarding gender. I'll not go to the second question, but yeah, I think so that will be answered quite well into this. And actually, if we would talk about the gender differences biologically, they are not many. Not many at all. Both girls and boys need the same kind of environment. The nurturing care framework talks about for all children, irrespective of gender, class, anything, location, any other area that can discriminate. So that's the first thing. Some studies do inform that girls do pick up language. They are a little faster on language development, fine motor skills. Boys are a little faster on gross motor skills. But again, when we are talking about the uniformity and the milestones, they are, every child is an individual and they may differ from one to one person. So better not to talk about gender as a criteria for biological determination. But yes, in our society, there are social determinants and there are biases which our children do have to face. Starting right from the beginning, before birth conception, we know that people prefer a male child to a female child. So obviously, the women who's pregnant may not even get an adequate meal. The meal that she needs, not only for herself, for the child that the child is developing within her, she'll not get that kind of a nutritious diet. And again, as Dr. Charu was talking about, it's so important. The rest, the well-being, the health, everything has to be very important. If a girl child is born into a family, that's the first discrimination. They feel that they have a burden in the family. And going back, yeah, in urban areas, situations are slightly changing. I'll not say completely, but in the rural areas, they're still, they're burdened because they have to be married and there'll be so many of dowry and other things that are attached to a girl child. So when it comes to compromising, the girl child does not get proper nutrition. She's the last one to eat. She may not get opportunities for going for education. If she does join any Anganwadi which is close to her house, as she progresses in education, if the primary school, if the secondary school is not located nearby, she'll have to drop out because parents fear that she has to travel a long distance. Many times, due to the household burden, the child is kept at home. No, you please have to do the household responsibilities because both the parents are out working. So in terms of play, the cars are for the boys and the dolls are for the girls. She has to start cooking right with the dolls. So those kind of discriminations are something which affect the child's growth. When a girl is growing up, she's told to obey, she's told to be obedient, disciplined, and learn to work. Boys, on the other side, are given full freedom. They can be out. Negatively for the boys, yes, they are told that they should not cry. They have to be the strong one. And that's unfortunate because they do not learn social emotional regulation at the right time. One needs to express, you know. So I can go on and on, but I think so if we can, kind of look at these biases, create a inclusive, equitable environment, irrespective of the gender, I think so both girls and boys need a space and ecosystem to thrive. Thank you.
So thank you so much for enlightening us on this very critical issue. Now we have another question from Shushanta. We are working with 10,000 tribal women, farmers household in the remote block of Koraput district in income and nutritional security. How we support the women farmers household in early childhood care. I would like Shashank to kindly address this. Shashank,
Yeah,
would you be able to?
yeah.
Uh,
So can you please repeat the question again? I think.
sure. It says we are working with 10,000 tribal women farmers household in the remote block of Koraput district in income and nutritional security. How we support the women farmers household in early childhood care. They're more focusing on women farmers, how they can work on this. How can
Yeah,
they support?
yeah. So I think here comes the community crash model intervention, because we have developed this community crash model with the objective where both the parents are involved in the community. Their children should not be left behind. They should be getting a proper nurturing and safe environment where they can learn and explore. Similarly, if you are working in tribal areas where you are focusing on women farmers, so I think we need to create a kind of a setup or a model where children can be left behind and they can explore, they can learn, because they cannot accompany their mothers to the farmlands, because they may not, again it would be the violation of their right, I would say, because they're losing the critical phase of their journey, learning journey. So I think if they are in the safe zone, if they are in the safe learning space where they can learn, they can grow, I think that would be much better. And here the community role and participation comes, where the if you train few people in the community, they may charge some nominal fee, or as per the community understanding, they can do something and they can set up an environment where children can be left and they can at least learn and explore things. They can be in the safe zone.
Thank you so much for answering this. Now we have another question from Aditi. She's asking, generally, nutrition and early childhood education are addressed separately in ICDS. How to integrate both in the program to achieve holistic outcome? I would request Dr. Charu to kindly address this.
Am I audible, Tanu?
Yes, you're audible.
Yes, thank you. See, nutrition and early childhood. These should
Uh, your voice is breaking, Dr. Charu. You're not audible, Dr. Charu.
monitoring. Yeah, am I there?
Now it's audible. I think there's a problem with Dr. Charu's connection. Uh, can I please request Dr. Anubha to address this? Dr. Charu, I think think there's a
Tanu,
problem with your internet connection, I suppose.
maybe
We
it's a
won't be
low.
able to hear you. Now you're audible.
Am,
Now you're audible.
am I?
Please go ahead. Please go
Okay,
ahead.
there is
Thank you.
some low bandwidth issue going on. Just, I
No
would
problem.
like to say a
Sure, please.
strong coordination among Anganwadi workers, ASHAs, ANMs, health professionals, and preschool educators is essential, is very essential. This integrated approach aligns with the nurturing care framework also, recognizing that child who is well nourished, healthy, protected, with stimulating learning opportunities is more likely to achieve optimal physical, cognitive, social, and emotional development. Yes.
Thank you so much, Dr. Charu. And we have question for Mr. Shashank. Ms. Shivangi is asking, what are some of the biggest challenges faced with while delivering an ECCD program at the community level?
Yeah.
And
So, yeah. Should I answer?
sure, please. It's for you
Yeah.
only.
Yeah, sure. So when we are working in the community, as I've mentioned during my presentation, the problem is the unstable community, because the in the urban slum community, especially in cities like Noida, Lucknow, Chennai, Bangalore, majority of the people who are living in the community, they are the migrants. They're coming from underdeveloped districts or from the rural space in search of better opportunities. So this is the major problem that we face when we are working in the community, because they are unstable. They keep on moving from one place to another, and in this process child are the one who suffers the most, because once they are in, they don't get enrolled properly in neither in the Anganwadi, they don't also understand the importance of education in their parents. And in also in the majority of cases, these children are the first generation learners. Even when they are enrolled in the Anganwadi centers or the school, they don't get the proper guidance from their parents, because their parents also don't understand the importance of education. And in the entire process, children are the worst sufferers. So again, the unstable community, informal settlement is the challenge, but still we work very collaboratively with the community to overcome such challenges, so we can, create a deeper impact.
Yeah, we have another question from Mr. Satvik. He's asking, many early childhood development programs show positive outcomes during implementation, but sustaining those gains after project funding ends remains a challenge. In your experience, what are the most effective strategies for embedding ECD into local systems and communities so that the benefits continue for children and families in the long term?
Tanu, is this for me?
It would be nice if you can address this.
Okay, I thought. Yeah. So actually, when we are working in such kind of setup, where, because we see, we whenever, as I've already mentioned, that when we are working in early childhood care and development space, we need to be very patient, because you will not get the desired outcome in the, like, in 1 or 2 years of intervention. You have to be patient. You have to spend a lot of time, because child is the only outcome that you will get. Rest are the inputs. So when you want to sustain the impact that you have created on ground, you need to have a greater community participation. At the same time, the government participation should increase, and that will only come when you are designing a proposal and you are having a convergence approach. And when I say convergence approach, it is not just the partnership between the organization, it is also the thematics, like education, wash, health, educate, ECCD. They should all come together and work for the children, and that will only increase the community participation, because you are also trying to connect them with the social security scheme. So when all these things will come into picture, you will be able to create a holistic picture, and then the impact will sustain over a longer duration.
Thank you so much, Mr. Shashank. Now, I also do have a question for Dr. Rajesh. Mobile phones nowadays are the new nannies. So, what's your views on it?
Yes, Tanu, that's a grave and a very important question. So I think so. There's a lot talk going on, and yesterday only I was seeing Dr. Himani talk about it. The Indian Association for Pediatrics has given guidelines, and there's an American Association for Children also that has guidelines. So they talk about, The first 2 years of infancy is a time when the child should not at all be exposed to any kind of screen, whether it is a mobile, whether it is a TV, or any other digital screen that impacts. And we say that today the infants, as soon as they are born, they have a mobile in their hand. And many times as they are growing up, they are able to operate the mobiles much better than us adults. We may not know so many functions, but they know it. As we progress again between 3 to 6 years, the screen time is about 1 hour, and that too also with supervised guidance. And gradually it moves to 2 hours and further. But unfortunately, we as parents and adults are so occupied with our day to day, professional life is there, and there is a domestic life. Both these personal and professional front take away our time. The easiest thing is to hand over the mobile to the child. So, yes, as you say, it becomes a nanny. I would really encourage parents to identify activities where they at least in front of the children are not completely engaged with the mobiles. Children learn through imitation, children learn through observation. When we are on a mobile with the child feels it's something very important my father, my mother, or any adult is doing, and I would want to do the same. So they initially start with maybe a pencil box or a wooden block, and they speak with the even a toy telephone, the parents do give. But gradually they realize, oh, this is redundant, it doesn't make any noise, it doesn't show whatever my father or mother are doing. So they understand that. So in place of mobiles, if the parent is reading, the parent is cooking, the parent is mopping, cleaning, talking, any kind of activity, try to engage children with you. Do not keep them at bay. Let us have shared experiences where I'm also doing something my child is doing. Even if I'm cutting a vegetable or a fruit, can the child have a blunt plastic wooden knife and can cut maybe bananas, something which is soft, and the child will be busy. So I cannot talk about more activities, but yes, we need to identify various ways. A dough, if you're making chapatis, give a dough to the child and let the child roll chapatis or make whatever the child wants. These are very exciting things, believe me. If the children sees in the space these interesting activities going on in place of mobile, they'll also be attracted to it. But try to keep and avoid child using from mobiles. They're going to use it as it is. The minimum, the better. Thank
Very
you.
truly said, ma'am. Very truly. It's actually our presence. They don't need the present, they need our presence. That makes a difference. So I would like to share somebody's personal reflection here. Mr. Subrat, he has shared his personal experience. He's saying, when I first started working in early childhood care, I had also just become a new parent. As I learned about responsive caregiving, play-based learning, storytelling, talking with children, and the importance of everyday interactions, I consciously started applying these practices with my own child at home. Over time, I could see positive changes not only in my child's learning and communication, but also in the bond or in the family. This experience made me real, and that ECC is not just a professional field, it is something that can transform our personal lives as well. My biggest learning is that children do not need expensive toys. Yes, they don't need your expensive toys or complicated learning materials. What they need most is a caring adult who spends quality time talking, listening, reading, singing, and playing with them every day. Because I have experienced these changes in my home, I genuinely believe that every parent can do that. Wonderful. Thanks for sharing your personal experience and insights, Shubrat. Now, as we come to the close of today's webinar, I would like to extend my sincere thanks to our distinguished speakers, Dr. Anubha, Rajesh, Dr. Charu, Chugh, and Mr. Shashank Khare for sharing their valuable knowledge, experiences, and perspectives. Today's discussions have reaffirmed that early childhood development is a shared responsibility. And by investing in nurturing care, empowering caregivers, and strengthening systems, we can create an environment where every child has the opportunity to thrive and reach their full potential. I would also like to thank all our participants for joining us today and for your active engagement. We invite you to stay connected with OneStage to our social media channels for updates on our upcoming initiatives and events. And if you have any questions or feedback, please feel free to write to us at partnerships@theonestage.org. And on behalf of OneStage, thank you once again for being with us today. Have a wonderful day ahead. Thank you very much.